Official title, as I have on my notes here in the studio, Director of Network Quality Improvement and Compliance at West Michigan Community Mental Health. And before we even dive into the mental health stigma, you wear a lot of hats there at CMH, and we love having you join us this morning. So good morning to you.
Good morning, Chris. Thank you.
Yeah, absolutely. We have a topic this morning, and for the listeners or viewers and listeners on the air, and of course over the digital platforms that we have, and as we mentioned just a few minutes ago on the air, about that they can watch this on our Facebook pages and our YouTube channel. But mental health stigma. It sounds, I don't know, generic, or what's your thoughts behind that as we dive into that topic? And what is that stigma? Can you break it down a little bit for us?
Absolutely. So stigma, the word actually comes from an old Greek word that means a sign on the skin. And what it means is the way we use it is it's a set of negative and often unfair beliefs that a
Okay.
society or a group has about something. So think of it as like if you wore a mark on your skin that told everybody something bad about you. The idea of stigma is this, it's a set of beliefs that folks have based upon something they know about you. They have some stereotypes or some negative beliefs or thoughts.
And
So when it comes to mental health, right, it would be anything to do with mental illness or substance abuse, folks having some negative reaction to that knowing that about someone.
I know I've asked this question to your team in the past, but I think it's a very important question to bring up. Do we still, if you had to put a scale, the positive, the negative, that perception out there from us that maybe tend to either look at people and say, oh, that person's going through that, or we can all be judgmental, I guess is what I'm trying to say. Positive, negative when it comes to mental health. Where's the scales balance these days? Do you have a good handle on that?
I think it's better than it used to be. I feel like mental health treatment has become more normalized than it was when I started working at community mental health, which was a long time ago, 24 years, I think.
Wow.
I did some projects at that time studying stigma in our community and gathering community attitudes about mental health. And I do think that you hear more and more people talking about how mental health is important, mental wellness is important. So I think it's improved as we talk about it more. But I think it's still a real issue, especially when we talk about more severe mental health issues, things requiring hospitalization or addiction.
We got you
Just go
break it up
away.
just a little bit. Oh, there you go. There you are.
Okay,
Uh,
sorry. Yeah, I was saying it's getting better, but I think when it comes to severe mental illness and addictions as well, there's still some negative underlying beliefs. And definitely we think about it differently than we do think about physical health.
yeah. I know I've got some questions for you, but if you don't mind me expanding some of those things, I think that would be important for the audience. When it comes to physical and mental, can you expand, I guess, upon that? Where obviously you focus a lot on the mental side of things,
Mhm.
which I think can be as important, if not more important, than the physical side of things. Is that an accurate statement?
I think it's important just to remember that they're connected and that we should really consider our mental health. It's part of our overall health. And I think when folks think about physical health issues, they might not they might think that, oh, the person isn't to blame that they have
Mm.
that they need surgery. A person isn't to blame they have a heart condition or cancer. And when it comes to anxiety or depression or um, more severe illnesses like bipolar, schizophrenia, or even addictions, well, I think we're more likely to think the person just needs to. That somehow there's a judgment. The person just needs to do these things differently. Oh, part of their problem is because they always do this, or to even blame the person for having an addiction. And I think that's a real difference between how we think about physical health and how we think about mental health. And that can be really damaging for a
Absolutely.
person that's in trying to be in recovery and get treatment.
Hmm. And it makes your job and your team's job a bit harder when you have those outside influences that are kind of beating up or adding to that person's mental health and their stressors that comes along with.
It can number one, it can delay a person from seeking treatment. And especially I think for people that have more mild to moderate needs, we might see this especially in older generations or in men, that they're less likely to reach out and ask for help because they think, oh, I'm not crazy. Oh, I don't, my problem isn't that big of a deal, because they don't necessarily want people to know, or they don't want their family to even know that they're reaching out and seeking help.
Yeah. Mental health is health. Why is that statement so important?
I think we're pretty well coded to think about that it's important for us to take care of our health. I think that's just part of adulthood is knowing that you need to take care of your health if you want to live a long and healthy life. And I think if we ignore mental health, then our lives aren't going to be as productive and healthy as they could be. We're not going to be as happy. We're not going to be as good of a partner, brother, sister, parent as we would if we were taking care of that mental health as well as the physical health.
Yeah. You mentioned this a moment ago, and I think it probably, and you focused on men and the older, but this also can extend into that younger generation, I would assume, when it comes to this stigma, and it can create sort of a barrier. If we're around our peers all the time and we don't want them to necessarily know what's going on in our lives or be able to, and I say this word again, judge us in some way or another. That stigma can create very true barriers that slows down the process. And that second, I think probably the additional question I have for you in regards to this being generational, but also the more we slow that down, can it really put us in a rut that we might not even come out of?
Yeah, I think for any person that's really struggling with a mental health issue, or especially a severe mental health issue, a more serious problem, it can become almost worse than the symptoms of the illness itself. Dealing with the social isolation that might come. If we've got a young person, I'm thinking maybe a high school student, for example, who has missed some school because they had to go into an inpatient treatment facility for a period of time. We live in a small community where people know each other's business. Things, and coming back from that can be hard. Young kids especially can have all kinds of ideas about what does that mean. I think a lot of kids probably have images in their head from maybe a haunted house they went to, or movies they've seen of straitjackets and spooky things that happen in inpatient treatment. And inpatient treatment is not like that at all. This is really healthcare, going into the hospital. And so I think, kids might deal with a lot of misconceptions from their peers, and feel like they're different and separated from others. And that social isolation is incredibly difficult for anyone. It's especially difficult if you're already dealing with, let's say, depression or severe anxiety. Yeah, so it really does compound the stigma. Really can compound the difficulties of living with a mental illness, or trying to get better from a mental health problem.
If you're just joining us this morning, we're talking with Betsy Reed-Henry, Director of Network Quality Improvement and Compliance at West Michigan Community Mental Health. The word burden comes to mind, but I don't think it's the right word to use. But I'll ask it anyways, using that word. Uh, where does the burden of trying to prevent that stigma come into play? Is it on the person that is the one struggling, the patient, or does the burden, I would assume, extend onto those peers and those individuals around that person? Do we try to block it if we're going through those things, or is it their issue and their problem? Those that are creating that stigma.
I think, yeah, that's a really good question, Chris. I think what you're getting at is how do we make it better?
Mm-hmm.
How do we, who's responsible to try to break that stigma? Very hard for a person who's struggling with a mental health problem to take that burden on
Yeah.
themselves.
Yeah.
I think it's really important for all of us to, especially, those of us who are parents, those of us who are in leadership positions, and or have voices in the community, especially if you are affected by mental illness in your family or yourself and you're in recovery, is to spread that message that mental health is health, and that we should normalize seeking treatment, and that mental illness is very common and treatable, and take away some of the drama around the idea, because it's just a normal part of life.
Mm-hmm.
Going to get therapy is like going to get physical therapy. If you have, let's say a problem with your shoulder, you're going to go and take care of it. Same
Mm-hmm.
thing if you're having a problem with, feeling overwhelmed or down or depressed, you should take care of that and go to therapy. And really, I think it's something most people should do at some point in their life. I've done it myself twice, maybe three times. So it's something I highly recommend. And I think if we just normalize that and make it part of the regular conversation, that's one way that we can help break the stigma. I'd say another way is if you know of somebody in your acquaintance who is struggling and you hear about it, you don't need to keep that a secret, or you don't need to avoid talking to them. And I think that's something that people tend to do. When we have a friend who has surgery, we might start a meal train and bring casseroles. When we hear that someone has had an episode where they had to go and get mental health treatment or they had to go into rehab, people skirt around that and won't touch it with a 10-foot pole when they're talking to the person. I think it's okay to say, "How are you doing? I heard you're having a hard time lately. Is there anything I can do to help? Can I bring you dinner?" And just like you would if somebody's having a surgery. And I think that's a way to break some of the social isolation that can come with that, and really to be supportive of that friend or family
Do,
member.
does that extend to when you have patients or clients in therapy? Do you find that comes up in conversation quite a bit, that they would have wanted people to talk more or reach out and discuss that? Is that what they're saying as well?
Well, first of all, I'm not a therapist, so I kind of wish I were, because I feel like that would be a really great job, maybe
Yeah.
in my second career.
Yeah.
But I would say I think it's a common experience for people that they want to be supported and they want to feel heard and known by the people that
Yeah.
care about them.
Absolutely. Let's talk about um, uh, kind of isolation. That can probably be really bad for somebody if they're going through something at that moment, and then they decide to isolate themselves a bit more. And you touched on that just a moment or two, but that can really again push somebody into a dark spot that it's more difficult for them to come out of. And to what you alluded to earlier, which is decide to reach out for that help. Um, when somebody goes into that isolation, I would assume it does take their peers and a bit more strength to come out of that.
hmm Yeah, isolation I understand, is a pretty common um, sign that someone is struggling. If you have a friend who has maybe struggled before with depression, for an example, I think probably many of us can think of a friend or a family member who we've seen, you know, stop stop keeping plans, not hanging out as often, not doing some of the activities they normally do, spending too much time in their room, or in their apartment or home. And I think that can be a sign that mental health problems are really affecting the person. And it's also, I think, as a friend or a loved one, really important to reach out and ask that person how they're doing, and encourage them to, hey, let's do something, let's talk. I think that, that's one way that all of us can really support and show love for the people that we care about if we see that sign of that social isolation.
If you're just joining us, I want to do a reset here, Betsy. Betsy Reed-Henry, Director of Network Quality Improvement and Compliance at West Michigan Community Mental Health. You defined mental health stigma at the top of our segment. Do that again for us so that the listeners
Sure.
and viewers can kind of bring that back into the fold for a moment.
Yeah, so stigma is a set of negative and often unfair beliefs that we as a society might have about something, specifically in this case, mental health problems. Since you asked, I do want to talk about there's three different types of stigma that we've kind of categorized stigma around mental health into three different types because it's helpful to think about how we address each type. So there's the public or social stigma that would be like just the general negative attitudes that folks might encounter in acquaintances in the public, that can include just discrimination. There's also structural or systemic stigma, and that might be baked into laws, policies, that might limit opportunities for people. For example, it might be harder to get housing if you're a person who has a past of mental health treatment. Um, Also harder to get a job if you have some gaps in your resume, because there was a time when you were unable to work because of mental health problems, for an example. There's also, and this is the part I think probably goes unseen quite often, is the internalized or self-stigma. So a person who has struggled with mental health problems might start to believe those negative stereotypes about themselves, and that can really change the way they feel about their own value, and can change their self-efficacy and their likelihood to help themselves even.
Before we go into kind of myths and facts about this stigma, is it okay or is it fair to ask this question that we should try to eliminate as much of these stigmas as possible? Is that the goal of I guess everybody that's involved, from
Yeah.
those that are looking at it from inside and from outside?
Yeah, that really is the goal, is to help people understand the truth about mental health and mental illness and addictions, and knowledge is really the best way to one of the best ways to eliminate stigma. The other really really effective way to eliminate stigma is to actually get to know someone who lives with mental illness or addiction. So those of us who have close family members, we might we might have a more open mind. For example, if we've had a close family member who struggled with something serious. So yeah, but our goal is really to open our minds and think differently about it so that we can help eliminate some of that stigma.
And that's one thing I do enjoy, I guess, hearing or knowing about West Michigan Community Mental Health is that part of your hiring process, in some cases, are individuals that have gone through these issues, these addictions and such, that have recovered, that have said, "Hey, I want to help others," and that's pretty powerful in itself.
Absolutely. Yes. That's we see that as being a skill set or an experience that job applicants bring to the job when we're looking for candidates for jobs. Having lived experience with mental illness or addiction is a plus. Because having lived through it, having gone through it, that gives people a really good perspective. That's very helpful as they're doing the work with others. Also, just having even for our administrative team, it's good perspective to uh, help a person really connect with the why behind the work we do.
Mhm.
Um, we also have lots of our employees have family members that have lived with mental health problems or developmental disabilities or substance use disorders. So yeah, that really adds to that and just that mindset of that this is really, really important and grounds us in the personal connection.
Absolutely. All right. You ready for this? We're going to do a lightning round, if that's okay. Myths and facts. I think we're gonna discover some interesting information in the next few minutes as we talk about this. Uh, Individuals with serious mental illness are more likely to be victims of crimes than to be violent criminals. Myth, fact.
And that is a fact. Um, I'd say especially in like older movies, and even just some psychological thrillers, you see a lot of characters where there's a connection in the character between some kind of mental illness and violent crime. And so that association is made in our minds. But the truth is that most people who have severe mental illness are not violent criminals. They're in fact more likely to be victimized by others because they can be vulnerable because of the hardships that they deal with.
Absolutely. Addiction is a disease, not a moral failure.
And that is a fact also. Substance use disorders are recognized as medical conditions. Brain chemistry, trauma, genetics, and environment all play a role in substance use disorders, and treatment works, especially when there's a combination of medication, counseling, peer support. People do get better. Also, it's important to note that shame reduces the likelihood that someone will seek help. So that idea that there's a moral failure increases the shame and actually hurts.
Here's one for you. Mental health problems are very common. Is it rare or is it common?
It's very common. And I think this is another thing that in the past few years, I see a lot more in social media. I hear people talking about more. I think people are starting to really kind of have that ingrained in their understanding of the world. Is that it's true about 1 in 5 adults experience a mental health condition in a given year. It's incredibly common. If it's not you yourself, it's someone you love, and you probably all of us probably have more than one person we love who has struggled with mental health issues. Most families are touched in some way. It's very common.
Absolutely. Asking someone about suicide doesn't put the idea into their heads.
Yes, and that's true. A lot of folks feel like they shouldn't ask a person that they're worried about if they've thought about suicide. They don't want to bring up the topic. They don't want to say the word. It is a difficult conversation to start, but it's important to know that you will not suggest the idea to a person by bringing it up. Asking them can be a life-saving question. So if you have a loved one you're worried about, asking that person, have you thought about suicide, opens the door to a conversation that can lead to them getting help. If they haven't thought about suicide, they'll say no. If they have, they will be relieved that you're bringing it up. And then at that point, really important to just listen with empathy and validate, like, I'm so sorry you're feeling this way. You must be going through so much pain to be considering this. And be a good listener and then commit to helping the person get to help. If you maybe help them make an appointment, drive them to CMH for an evaluation, or call our crisis line. Or if they just need to have someone stay with them for the next few hours until they can get help, then that's a role you can play as well. So there's starting that conversation is not dangerous, and it won't offend a person. It can actually help save a life.
Absolutely. And just listening to you today, I think about this information that we talk about, that I'm hoping that one of our listeners or multiple listeners or viewers are able to take this and help for themselves, but also try to eliminate that stigma. You can break it down very easily in conversation here, but it's probably a huge mountain to overcome in general. Is that right?
It is. Changing our deeply ingrained beliefs about something isn't easy. It's something that we should continuously work at by just having that caring, empathetic mentality, and learning. So your listeners that listened to this conversation today have already done some of that work just by listening to this conversation, and having that openness with the people you care about. It can also mean sharing with others that, oh, hey, I go to therapy. It's so helpful. I feel so much better. So yeah, those are all ways that we can continue to work at it.
As we get closer to closing, I want to make sure that we put out the phone number so that if anybody does need that help, or knows somebody that needs help, that they can reach out if they have questions, and they can chat with 24/7 somebody there at West Michigan Community Mental Health, which is very powerful in itself. Before we do that, though, we've been talking about mental health stigma. What have we forgotten to talk about? Is there something that we want to make sure that the listeners or viewers know this morning, so that they can take that with them and make it a better day for maybe themselves or for others?
Sure. So, the listener base here, we all live in rural communities, small towns. And I think, as I mentioned earlier, in small towns, word travels and gossip can travel. But in small towns, we also care about each other. And I think that that's a good thing for us to focus on. If we care about our loved ones, if we care about people's health and mental health, remember that in small towns, we care about our neighbors and we help each other out. So instead of spreading, gossip and negative information about folks, instead put your focus on the caring that we do. Reach out to somebody that is struggling with something, offer to support, talk to a friend who you might be worried about, and that really is part of how this community is.
Yeah, it can go a long way, can it? That's pretty powerful. I can't thank you enough. This is some really great information. We want to make sure that if the listeners or viewers missed any of it, they can watch it on our Facebook pages or our YouTube channel. It'll be there. And more importantly, that 800 number, 800-992-2061. You have individuals that are staffed there 24/7. For somebody that, if they need to reach out for any reason, that they can do that, and they do, right in the middle of the night, in the evening. If somebody makes a comment, if they feel down, if there's something that puts them in an awkward or uncomfortable situation, those individuals on the other end of that phone number, they're ready to help.
Yes, absolutely.
Well, we appreciate them, and we appreciate you. And that phone number is published on our Facebook page, and we'll make sure that we continue to push that out there. Betsy, you know how important these segments are to getting the word out. You talked about it earlier about it starts with knowledge. It starts with that information. So I want to thank you for taking the time this morning and discussing this topic and more in the future as well.
Thank you so much, Chris.
Absolutely. It is 102.7 Mom FM and Hot Country Hits 99.9. And if you missed any part of this segment, again, it's available on our